Okay, going live. Hello, this is Angela, a nurse practitioner with Recreate Health and Wellness. Hello, everybody. How are you doing? I am here today to go over anything and everything that you want to know about GLPs or any hormones, anything like that. So this is a nice, safe place that you can ask any questions that you have. I am actually streaming on both of my pages, Recreate Health and Recreate Wellness. So you are able to ask anything and everything that you want to know regarding GLPs. We're just waiting for some people to get on here. So what we do is we can talk about anything that goes with these medications, because a lot of people are on them. And my biggest concern is to make sure that people are safe, make sure that you understand how to take them. I am actually a nurse practitioner, so I just want to make sure that you know how to take these medications, because if you're not taking them the right way, you can get very, very sick. So we want to make sure that you know how to take them properly. So a lot of times people want to talk about constipation, because that's a big one, and that is what really does make people sick. And so, here we go. Haley said, first shot last night, nausea with migraines, sipping water now. Should I sip a protein shake? You always need some extra nutrition. So I definitely would sip a protein shake as long as you're not throwing up. If you're throwing up, then you want to just stick to the hydration and the electrolytes. So the migraine, that could be from a low blood sugar. So you definitely want to try to get a little bit of, make sure you're staying hydrated. Reach out to your provider if that nausea, because they can actually give you some Zofran, which is really going to help you with the nausea as well. So I would definitely recommend that. So definitely getting something in for the sugar could help with that also. So definitely get some protein in there. Hydration definitely can help you as well. All right. Oh, good, Haley. Yes. You can actually, it depends on what dose they gave you. A lot of people like to give out that 4 milligram. So you can take that every 6 hours if needed, but check with your medical provider and they can tell you how often you can take it. I've always put my shot in my thigh for a year. Should I switch my stomach for best results? I personally, and in my practice, we have seen that the stomach gives you the best results, but can give you the most side effects. So if you're getting more side effects, you want to go with your thigh or your arm. So that's really what makes the difference. So some people just like to switch it up, so if you want to switch it up, go for it. It's not going to make any difference. And so somebody here, good citizen, said they've had amazing results. It is really incredible. Absolutely incredible. I really you could see my picture in the background here. Let me move this for you. That's my picture in the background there. So you could see that I've had incredible results as well. I've been on this for 4 years. I've actually have myself amazing results, and I've been prescribing it for 4 years. So I also am just really so happy with the results that I've had. GLB has been the best thing that I've ever done for myself. Amen. Amen, sister. Me too. I would never, ever change it. And I don't ever want to go off. I never, ever want to look like that person again, ever. Because, I have, definitely changed my life, and I've changed the lives of so many others. And we do service 47 states. So if you ever can't get it, or if you need help getting it, or if we do a free consultation. So if you ever need help, because your providers aren't helping you or you can't get a hold of somebody, definitely reach out to us because we're here for you. We help with a lot of symptom management, side effect management, anything like that. We're here for you. They upped my dose after 5 months, but now I'm getting diarrhea for 2 days every week. Is that normal? Sometimes, yes, that can happen. Probiotics, fiber, you have to take those. Every single person, regardless of diarrhea, constipation, normal bowels, you should be moving your bowels every single day. Every single day. And you need to take fiber, you need to take probiotics, you need to take magnesium because it is what you need to do. And that you have to. So our cost for S is $2.99 and our cost for T is $4.50 in most states. And we do have financing available, so there's a lot of different things that you can do, but for bowels, you have to take your fiber. You have to take, and I like Metamucil gummies. I love gummies. I think it's like tricking me into thinking I'm getting gummy bears every day, but you have to take your fiber. You have to take your probiotics. And if you go to my main page, which is Recrea Health, I do have 2 pages. So you might see me streaming right now on 2 pages, which is very true. So I have Recrea Health and Recrea Wellness. My backup page is Recrea Wellness. My main page is Recrea Health. I like to get in trouble sometimes on here. So that's why I have 2 pages. So Recrea Health is, I have a lot of products and I try every single product. So I don't put anything up that I don't try personally. So I love Leaf Air and I like ZenWise. So if you get sulfur bursts or you're having digestive issues, get ZenWise. If your digestive is fine and you're not getting sulfur bursts, then that's when Leaf Air comes in. And they both do have that vaginal health. If you're a male and you need a probiotic, reach out, DM, and I can help you. Okay. So that is the bowels. So you definitely, for, digestive issues, diarrhea, constipation, I highly recommend. Don't take magnesium if you do have diarrhea because magnesium can help you move your bowels. Okay, so you want to hold off on the magnesium. Now, if you're still not moving your bowels every day, then I highly recommend that you take the Miralax as well. Okay, so that's really important also. All right, so let's see here. I got lost. It jumped down to the bottom. Give me a second here. Okay, I'm on vacation, forgot my Zepbound. I'm 2 days late. My shot, when can I get home? 2 days is fine to take your regular dose. The second you go over 3 days late, then you need to decrease your dose because you will get sick. And that means nausea, possibly vomiting. So I highly recommend that if you're over 10 days and you haven't had your shot, then you need to decrease definitely. I do find it exacerbates my POTS syndrome a lot, but still manageable. Make sure that you're taking your fiber, your probiotics, and make sure that you're moving your bowels every day. Do you have recommendations for autoimmune diet to help with inflammation? The same diet for inflammation, autoimmune disease is no simple carbs. If you get away from the sugars are, no sugar in your diet is what you're supposed to be on regardless for GLPs. But a non-inflammatory diet is no sugars. So that is a GLP diet as well. That should be a across the board diet in general is no sugar because the sugar is an inflammatory causing problem. So you want to get rid of sugar in your diet to get rid of the inflammation. So that sugar is going to cause indigestion, belching, nausea, sulfur bursts, inflammation. I will start throwing that one in there all the time. And it can cause diarrhea. So you want to stay away from the sugar. All right. I am on week 5 and just went up. I have no side effects and have no L. Is that normal? So when you have no L, you hit the stall or you just aren't having anything going on. So what you need to do is you need to look at your calories. So nobody likes to count calories, but I'm sorry, it has to happen. So we never go less than 1,200. And women typically need to be 13 to 1400. Guys are typically 16 to 1800. Now, I know that's not everybody, but that's typical. And your protein needs to be women at 100 grams a day, guys at 120 grams a day. And if you're not counting your calories and you're not counting your protein, then you're not going to have your L. So you need to make sure that you're doing those things. And then if you're still not having your L, then reach out for a free consultation, and my team and I would love to help you. And Wendy, you are absolutely, anytime, any question, please ask. Della, I have had O for a year and I'm taking R. I have no opinion. Well, I do have an opinion on R. I have no experience with R. R is currently not FDA approved. It's not released by Lilly. It's only available on the gray market. I am not allowed to prescribe it. I don't have any experience with it, and I'm not allowed to prescribe it. So I can't give you any information on it. Anna, why is it that I started this and I'm actually more hungry? Because you may not be getting enough protein, you may not be getting enough calories, or you may not be hydrated enough. So you need to make sure that you're doing those three things. You need to make sure you're getting your protein, your calories, and you're hydrated. The doctor also just increased me to 2 milligram. So maybe I'll try. Yeah, try your stomach, try your arm, try your thigh. If you're not getting what you want from one area, try another area. Absolutely. I'm taking compounded tea. It's just compounded with saline. How many units do I start with? Reach out to your provider, but you always do the lowest absolute dose possible, because every compound is different. So if I give you what I give my patients, it's going to be different because the concentration is different. So my concentration is 20 milligram of 1 ml, where a lot of the other compoundeds are 10 milligram of 1 ml. So my concentration is a lot different. So I can't tell you specifically how many units you need to start with, because my concentration is different than other pharmacies or other clinics. So you need to reach out to your clinic and ask them, or your pharmacy, of where you purchased it from. This is what irritates me more than anything, is that you are able to get these medications and you aren't given the proper information. That is so scary to me, and that's why I'm doing what I'm doing. So Mom, if you can't get that proper information, please reach out to me, because if I talk to you more specifically and I get a little bit more information, I can give you that information. But I can't give you that information with just that little information that you did give me. So if you aren't able to get a hold of the clinic that you purchased it from, then we can give you that, and I will give you that information for free. Can MJ be giving me POTS? I don't know exactly. That's not something that I've heard that it can do, but I don't know for sure. So that would be something that I would ask you to reach out to maybe your primary and ask them that question, because I don't know for sure. I'm sorry. That's not, I don't know. That's a good question to ask. I'm going to write that down. I end up, you guys always stump me. To be honest, I will write that down and I will find out. So Maria, if you could DM me that, and then I will research that and I will find out. GLP is the best thing I've ever done. It's not about just WL. You are 100%. I just had a patient in here today. I think he has lost 70, but he has had all of his lab results, all of his everything, and he went to his primary care and they were so happy with all of his other numbers and results, and they were just so pleased with everything. It is amazing on what it does to your health. I used this is an app, Lose It, to track calories and exercise every day. No breads, no pasta, no rice. That is what I teach, simple carbs. And basically, simple carbs are anything processed white. White sugar, pasta, flour. I'm sorry, I said it wrong. White sugar, flour, pasta, rice. Anything processed to be white. Now, you can have jasmine and basmati, because somebody's going to be freaking out. Oh my God, I can't have rice. It is processed white rice. So if it's naturally in the earth white, you can have it. But if it's processed to be white, don't eat it, okay? That is the bad stuff. If it's naturally in the earth, you can have it, but you don't want it if it's processed white. Easiest way to look at things and easiest way to avoid the bad stuff. If it's naturally in the earth, you're okay. That's the easiest way to look at that. So what's a good probiotic? Leafair is one of my new favorites. It's Leefar, and that's on my main page, Recrea Health. My backup page is Recrea Wellness. So if you go to my main page, which is Recrea Health, then you can find Leafair. The other one is ZenWise. I probably like Leafair because it's a gummy. I'm not going to lie, I like my gummies. But Leafair and ZenWise is a really good one. So that is really, really good. If you are doing exercise and meal prep and you, all right, and you're doing that for over 20 years without results, you need GLP. That's what I was having a discussion with somebody today. In my clinic is, people were saying, oh, he's cheating and, he's not, he's cheating because he's taking GLPs. Well, he did what you did, exercising and meal prepping and eating properly and all of this stuff for years. And then he threw in the GLP and then he actually started to have that L. Well, guess what? Once you throw in that GLP, now you can't eat as much. You don't have the hangry. You no longer have that noise in your head, and you get rid of the insulin resistance, and you're going to start having that L. It's not cheating being on GLPs. It is actually helping you with all of those other symptoms that you have, which is fantastic. I also keep my protein up and take all of my supplements. I'm just scared it won't work for me. It will. It absolutely will. You're doing all of those things fantastic, and you just need to add this in. If everybody could please follow both of my pages, Recrea Health and Recrea Wellness. My clinic is Recrea Health and Wellness, so hence the name of both my backup page and my main page. And then if you could please share my live, I would really, really appreciate that. I was afraid it wouldn't work, but it does. Keep exercising and meal prepping. Fantastic. You guys are awesome, and it's wonderful that you're supporting each other. It is a really good thing. Please follow both of my pages. I do a lot of education and teaching. That is my main reason for doing this. I really am here just to keep you guys safe. That is all I want to do, is just to keep you guys safe, because I don't know of anybody else that's out there that is trying to just keep you guys safe. I am a nurse practitioner. I have been on these meds for 4 years. I have been prescribing them for 4 years, Jenny. So I really do know a lot about them. I have experienced a lot about them. I really try to understand what's going on. So a nurse practitioner, basically, I have 9 years education. And no, I am not a doctor. I am not a pharmacist, and I would never claim to be. I actually correct everybody that ever does call me one, because I am not one. So I don't want to be one either. I really don't want to be one. Is the food noise worse on one or the other? No, actually it's not. I have found, I've actually been on both twice now. And so, yes, at Recrea Health is my main page, and Recrea Wellness is my other page. But I have been on both. I'm actually on T right now. But I have found when I'm on T, it takes a little bit higher doses in order for it to really start working. It doesn't work right away. When I'm on S, it tends to work quicker. But I don't notice that either one has more control over the noise. I do notice, though, with T, I have more side effects. So I tend to get more nauseous. I've actually, on T, if I'm going to throw up, I'm going to throw up more on T. I don't throw up on either of them more than the other, but I do have more nausea on T. Just to let you know. My belly gurgles all the time. You can hear it across the room all day. And It might be because you need digestive enzymes. I would highly recommend getting the probiotic Zenwise because it has those digestive enzymes in it. It might be because the food's sitting in your stomach, but it also can be because you just need that probiotic just to kind of help your belly and help your food just digest a little bit better. Might be something that I would try. And also avoid those simple carbs at all costs. Low activity desk job female, is there a calorie amount that's too low? Less than 1,200 is too low. If you're eating 1,000, that is way too low. Laying in a dark room, just your heart beating, your brain functioning, your lungs, your body functioning, it needs 1,000 calories. So just by generally just moving and stuff like that, you need to have 1,200 calories. So if you go under 1,200 calories, you're in a state of starvation. So you definitely need to keep moving. Somebody else said they do Fitness Pal. I personally like the app Lifesum, Lifesum. It's free. It's a good app. Fitness Pal usually comes on your iPhone, so that's a really good one as well. I've been on MJ for 10 months, for 2.5 months. Sometimes we do stall. I actually had a stall for about 1.5 years. You keep the par for the course. Keep doing what you're doing and it happens, especially when you get in that BMI of 24.9 to like 28, 29. Because it's difficult. It's hard when you get into that area. So what you need to do is just keep going, okay? Just keep working on it. Just keep trying that activity. Watch your calories. Make sure that you're getting your protein, your hydration. There's something else that we really like. It's called LipoBurn. It's a bunch of vitamins. It's really good for you. It has fat burner in it. It has immunity support in it, and it has energy support in it. And it's something that you can get. You can DM us, and we can hook you up with that. But it's called LipoBurn. It can help with the stall as well. So that actually did help me break my stall. So I would highly recommend checking that out. Just DM us, and then we can send you some information on that as well. So that's a really good one. LipoBurn is what that's called. Hi, Angela. Hello, Carrie. Will I gain it back if I can't access? So what I highly recommend if you have to get off of this is wean off. Okay. We have it available in 47 states. So if you are interested and you can't get it, come to us and we can help you get it. So, but if you can't get it or you want to go off of it, you need to wean off of it. Okay. Highly recommend that you wean off. What that means is you decrease dose and then you stretch out the days. So what you're going to do is you're going to go down to like the bottom 2 doses, and then you're going to go out to 10 days to 14 days, something like that. Okay. We have it and we service 47 states. S is $299 a month, and then T is $450 a month. So we can definitely help you with that. So, if you can't get it, please give us a call and we can definitely help you with that. All right. I'm stalled. And so the stall again, yes, you can move up. Absolutely. You can always move up. I say if you stall or if you have the hunger and food cravings, you can definitely move up. Look at your calories. Never below 1,200 calories. And women, the calories should be 1,300 to 1,400. Guys should be 1,600 to 1,800. So, definitely look at that. I don't count macros. I will never count macros. If it gets complicated, I don't do it, and neither will you. So I don't count macros. I don't like it. I just won't do it. So basically what I teach is protein, 75% of your diet, complex carbs, 25% of your diet. Everybody that I've done in my clinic, that I've taught in my clinic for the past 4 years, if they do that, they do great. They lose W and they feel fine, and we've not had any issues. I have never taught macros because it gets complicated, and if it gets too complicated, people aren't going to continue to do it, and I'm just not going to do it. And if I'm not going to do it, then I can't expect others to do it, so that's why I don't teach macros. All right. My opinion on R. I am not allowed to prescribe it. It's only available in the gray market. I don't trust the gray market. That's stuff that's coming from other countries that's not FDA regulated. It's not coming from in U.S. Pharmacies, and it is not something that I am allowed to prescribe. The Ohio Board of Pharmacy, which I am located in Ohio, actually sent out many emails, and I did a class recently that said I am not allowed to prescribe it. So it is not released by Lilly, and therefore I am not allowed to prescribe it, and I will not prescribe it. So that's my opinion on R. What is your view on? Okay, so I tend to like Herbalife as my protein powder that I do. So yes, I don't like high lead levels. Nobody should be doing that to themselves. So I don't think that's a good idea. So I think if you are afraid of that, then that's something that you should be researching and avoiding. But here's the thing when it comes to protein powders and protein supplements and supplements in general. A lot of people can't afford those very expensive stuff and powders and protein drinks and things like that. So you have to get the protein. And if you can't get the protein and you are only forced to drink those less expensive ones, and if they have stuff in them that you're, that's what it comes down to. You have to do what you can afford. And unfortunately, if it has things in it that, might make you sick, so then it's a risk versus benefit. Okay, which is worse, obesity versus this? Then unfortunately, they have to make that decision for themselves. Does Pepcid help with the nausea? Pepcid might not help with the nausea, but Pepto might help with the nausea. But then I would ask your provider for Zofran. Zofran is very inexpensive. And even if you don't have insurance, you can get Zofran for like $8. So Zofran is very inexpensive, and you can get it pretty inexpensively. Make sure that you're using one of the pharmacies that, not one of the big chain pharmacies, but maybe one of your smaller local pharmacies, or one of the actually, I don't think I can say their names on here because TikTok doesn't like me saying names of places. But it's like $8, and there are pharmacy cards that you can use that will make it less expensive as well. I didn't know location makes a difference when you're injecting. Absolutely, 100% it does. So nausea and fatigue. So what you need to do with nausea is ask your provider for Zofran. And then fatigue, you can do the lipoburn, which is really good, and you can actually... So lipoburn is DM us, and we can help you with that. It has immunity support, energy support, and it actually has a fat burner in it. It's a vitamin that you can take every day. It can help with the stall, but it can also help with the energy. I thought that there was a heart risk with Zofran if you have QT in your family, elongated QT. That one I don't know. I've actually never heard of that with the Zofran. That would be something that you would want to ask the pharmacist or your primary care. I've never heard of that. If it is a problem, I've never heard of that, and I prescribe it all the time, and it never comes up when I am, when people are on any kind of heart medications or anything like that. So I would ask the pharmacist to be sure on that one, just to be on the safe side. I noticed if I take my shot on my arm, I get better suppression. That's interesting. Everybody is different. Every single person is different. So I say try different places and see what works best for you. So if you're trying it in your arm and it's better for you, or your belly or your thigh, try different places. It is not going to hurt you to try different places and see what works better for you. How soon is too soon to increase? I would not increase every week. Every 2 weeks, okay. But I would honestly, if you're new to it and you're just starting, every 4 weeks. I would not increase too quickly. What's the point? You're just going to increase your risk of having side effects. So if you're just starting this and you've not been on it before, then wait the 4 weeks to increase, because you don't want the side effects. that is really what you're risking side effects if you increase too quickly, honestly. And why do you want to do that to yourself? And just if you're having a hunger and cravings, increase your protein and make sure you're getting the right calories. Increase your hydration as well. Just joined and have been on it for about a year, and headaches are getting worse. Okay, so talk to your provider and figure out why your headaches are getting worse. Are you still getting your hydration? Are you getting your protein? Are you eating enough? Or are you eating too much? Because there's a lot of things that you really need to check into, because there is your body can adjust to it. But then what we do is we get laxed, and then we're not eating enough, or we're not eating the right things, or maybe we're not getting enough sugar, or maybe, so there's a lot of different stuff that you need to really look into, but definitely talk to your provider about that. I'm about to start Wegovy Saturday. Any advice on the how to get the protein? So how I get my protein, and this was actually a good question, and actually I'm gonna post a video on this. I do 2 shakes a day, one in the morning, one in the afternoon, and then I eat dinner. So both of my shakes are about 40 grams of protein each. Then if I feel like I'm not going to get enough protein for dinner, I'll throw in a protein water. This one has 20 grams of protein in it, and this one is called Ready. Okay, this is in my Recrea Health page. So like I said, all the products in my Recrea Health I have tried. I like this one as a black cherry, and it's pretty good. Plus it has electrolytes in it. So it's a water, so it's easy to get it, okay? So this is a Power Lift. So this one has 10 grams of protein. So I do 2 shakes with my protein, and they have milk. So I do 2% milk, which gives me some of my fats as well. And then one of my first protein shake in the morning has my caffeine in it. And actually we just got, it's called Split. It's a milk with caffeine, and that has protein in it as well. So I'll do a video today. I've been making everybody try it. So I am going to try that one also. Okay. Somebody said, Jackie said, taking fiber gummies, the gas is crazy. What is the alternative? First of all, when you start taking fiber gummies, you have to start them slowly. So 1 a day for a couple days, 2 a day for a couple days, and then 3 a day every day. Don't start 3 right away every day. So you have to start it slowly. So Jackie, did you do that? Or Jackie, sorry. Did you do that? Because if you do it all at once, it is going to give you horrible gas, and it's going to give you bloating. So you have to slowly work up whenever you start taking fiber. I've been on Wegovy for 9 weeks. Oh, I was taking 1 a day. Okay, then you must be very deficient in your fiber. So what I would recommend is try to take that 1 a day until that gas goes away, because you definitely need that fiber. And add in the probiotics, because the probiotics are definitely going to help you. Okay, you need that fiber. And yes, you're going to have gas if you aren't getting enough of the fiber. So definitely you need to do that. So I've been on Wegovy for 9 weeks, and I've dialed how much to lose per week. I have to be careful, guys, on my wording, so I can't read your questions exactly, so I'm sorry about that. So women are 1 to 3 a week, guys are 3 to 5 a week. That's typical. Now, that's when your BMI is above 30. So what happens is, as soon as you get in that 24.9 to 29, then it gets difficult, and it might not be that 1 to 3 or that 3 to 5. And then it gets a little bit harder. So that's when you have to be, you got to be a little bit more patient. You got to work a little bit harder. Okay. So I answered that one. All right. So I always start people out on S before I go to T in my practice. 1, because of cost, but 2, S has been out on the market longer, and in my practice, cost. I mean, I honestly, plus I can control the side effects and the symptoms. And plus I've had more side effects on T than I have on S, but I find it easier to manage and on S, the side effects. So I always say start with S, or if you're having any issues with one, go to the other, but always start out at the lowest dose. Don't just think that they're the same they're equivalent and you can switch from one to the other dose for dose. You cannot. You have to go back down to the bottom, okay? But yes, if you're having trouble with one, go to the other but I always say start with us. It's always okay to start with us. What do people think the difference is between what do you think the difference is between people who get no side effects versus awful ones on GLP? Everybody's different. Every medication is different. Every person tolerates medications differently. And that is all the medications that are out there. Everybody has different reactions to everything. And it is every single medication known to man. I can take it, you can take it, and then we're both going to respond completely differently. And that's why medicine's called practice, to be honest with you. Is it me, or does anyone start looking the same as I don't know what you mean by that one. Bone and body structure. I think we all look different, to be honest with you. All right. I've had pain in my right side where I injected all week. Sore pain, like something swollen. I would say, Kara, go to your primary and get that checked because that's weird. Or I didn't mean to say it's weird. That's not normal. And because if it's hot or warm to the touch or anything like that, it could be a possible infection, and we don't want that. What is the healthiest protein powder to use for protein requirements? That's a loaded question. I think everybody is probably going to have a different opinion on that one. I personally like health. Oh my goodness. Oh my gosh, I just lost the name, but I drink every day. What's my protein powder? Herbalife. Thank you. What in the world? Brain fart central there. I personally like Herbalife, but a lot of people are going to throw a lot of things up in these comments. Okay, everybody, what protein do you like? So everybody put in the comments what protein they like, because there's so many different versions out there, but I like Herbalife. If you want to link for that, just DM us and I can give you a link for that. I like it because it's whey free. I personally can't drink whey. It really bothers my stomach. But if you could tolerate whey, there's millions of different whey proteins out there. And that is, so what you can, it's up to you and what you can do. Somebody just a little bit ago was talking about lead and protein. I don't know anything about that. But there's so many different types of whey out there. Somebody just put up naked whey. There's a whey isolate. Whey isolate, that's what these are. I can't do whey isolate every day, but I can do it like every other and I'm okay. But it gives me rancid, horrid gas and bloating. So that's why I can't do whey. It gets me. Okay. I just thought of this. If you're just starting the shot or you haven't been on it for very long or you've been on it a while, please go watch my middle pinned videos or my pinned videos on both my pages, Recrea Health and Recrea Wellness. Please share my live. I would really appreciate it because that helps me educate more people. And the more people we educate, the more people we can keep safe on this. I'm sad I haven't got a huge relief from my inflammation, but also you know what? You will. The more WUL, the more you're going to have relief. So just hang in there and you will get there. Okay. 1 to 3 a week for women, 3 to 5 a week for guys. So you will get there. Just hang in there. Eat and work out daily, but no L. So it depends on where your BMI is. If you get in that BMI of 24.9 to 28 or 29, it gets difficult. So you need to look at the calories. Women are 13 to 1400, guys are 16 to 1800 typically, not everybody, but typically. Protein, make sure women, you are at 100 a day minimum and guys 120 a day minimum. If you are looking for something to just kind of like help a little bit, LipoBurn is fantastic. You can DM me and I can help you with that information. And it helps with fat burner, it has energy support and immunity support, and I can definitely help you with that. Hair, that always comes up. All right, before I even say anything, my hair is naturally thin. I have not lost any more hair being on these, but you need to make sure you're getting your protein. Like I just said, 100 for women, 120 for guys. I highly recommend Nutrafol Collagen. Okay. My absolute favorite has 10 grams of protein in it, but it is also a marine collagen. So it has MSM in it. It has megas in it. So it's actually really, really good for you. So this is a really good collagen that you should be taking to help with your hair, and it helps with joint support as well as skin to help, replace the elasticity in your skin, which I've been doing for 6 months, actually probably about a year now. And then I really like the Nutrafol Hair Vitamin as well. So these are fantastic. This has 95% efficacy of helping you grow your hair back and keeping you from losing your hair. So if you're interested in Nutrafol DM, message me and I can help you with that as well. So that is really a good idea. I am really far behind on my questions, and I know some of you may have to get to work or do whatever. So if I don't get to your question, please DM or message and I can absolutely help you. So any recommendations on what you need to know before you take these? Go to my middle pinned videos and you can, all the information you need is on there. I do a lot of education and teaching in my videos, and I have all the products that are on my Recrea Health page. I've actually tried them, and they're all products that you need to help support you in this journey. Or for my puppy, but you need the products that I put out are supporting products for your journey. I don't put anything up there that isn't going to help you with your journey. So, and everything I have tried myself or my family has tried. So on my Recrea Health page, all those videos are there to help you and support you and to teach you. And so, Angela, oh, great name, Angela. I'm Angela. But if you need any additional information, there's so much that you need to know. But the main things are, listen to your brain. Your brain is telling you that you're not hungry, you're not craving. Listen to it. Don't eat to full because you're going to throw up. Then the third thing is, this is an amazing journey. This is going to change your life. So welcome and watch my videos. Follow me, because I constantly give you more and more information. Okay, if you have pancreatitis or you have had pancreatitis, you can't take these, but you need to be very closely monitored. And if you're on these, you need to, if you ever get left upper quadrant pain, you have to stop immediately and go seek medical attention, because that means your pancreas isn't happy. But if you've had TPN and if you've had pancreatitis, you know exactly what I'm talking about. If you've had TPN, then you cannot take these. That is nutrition through an IV. You cannot take these if you have had that. Okay, I said it right. So if you've had that type of pancreatitis, or if your amylase and lipase levels go back up, you cannot take these. So you do need to be very closely monitored. And pancreatitis is very rare on these, but if you've had pancreatitis, you have to be very closely monitored. Okay, but you can take these. I have had people take them and they have had wonderful results and they've been totally fine. Thank you everybody for putting your protein in here. This is fantastic. Very, very good. S is Sema and T is Terzet. But we have to be careful saying that. I can't say it a tons of time because I get in trouble. Acid reflux. Stay away from simple carbs. Anything that is processed white sugar, flour, pasta, rice, don't eat it, because that will give you indigestion. The other thing is, you can try the over-the-counter medications like omeprazole, you can try Nexium, you can try Pepcid, those kinds of things. But if those don't work, then you can ask your provider. If you're not eating simple carbs, you can ask your provider for Protonics, which can help if you're not eating the simple carbs. Okay, that's how you get rid of that indigestion. The other thing is, you can take ZenWise, or ZenWise is going to be more for the indigestion, but your probiotics can help with that as well. So you can definitely do that. Really, there's nothing you can do to prevent the pancreatitis, because it's just one of those things that just might happen. Again, it's very rare, very rare. I have only heard of a couple cases, like 2, 3 on these lives. And I'm talking, oh geez, probably 100,000 people that go through the lives that I do, and I've only heard of a couple cases. So it's rare. It's very rare because I do these lives 3 times a week, and I've been doing them for months now. And and I have thousands and thousands and thousands of people that go through. So it's very, very rare. Very rare. Yes, Zofran is a godsend. Yes, I said 75% of your diet is protein, 25% of your diet is complex carbs. I do not charge membership fees, contracts. There are no contracts with us. There's no leaving us fees. Our cost is a flat $2.99 for S in most states and $4.50 for T in most states. That's it. We cover 47 states, so there are no fees whatsoever on anything. So that is that's it. You have a personal cell phone number to get a hold of us. So that is 100%. It is pre-filled syringes. So we take out all the guesswork, everything. Have seen a few people on TikTok saying that they got gastric paralysis. Dose too high. How to avoid. So that is one of the reasons why I do pre-filled syringes. What happens is a lot of times people get gastric paralysis because they have the ability to give themselves their own dosing out of vials. And what they're doing is they're overdosing themselves and they completely shut down their systems. That's why I like the pre-filled syringes, because I have the ability then to take out that part of it, and I'm not giving people that haven't had any kind of education and teaching on how to draw and mix up meds. It scares the crap out of me that that people that don't know what they're doing are getting one vial with bacteriostatic water, another vial with powder, and we're asking you to mix those things together, and then another syringe and telling you, okay, draw up this much and inject yourselves. That scares me. And you don't know how many times I've heard of people doing it wrong. And it's so scary to me. And that's why we do pre-filled syringes, and all of my patients love that. And it's really an amazing thing, and it really works out well. Hip replacement can I take the week before? No, most surgeons want you off for 2 weeks. Some will do 1 week, and the reason is because you're increasing your risk for aspiration pneumonia. Okay, that's why. So I have to have a colonoscopy and an endoscopy next Friday. So I can do my shot on Monday, but I can't do it before that. And the reasoning is because they sedate you. But actually for the colonoscopy, they don't want your colon all the way slowed down. But when you do like a full-on surgery where they intubate you, they want you to not have anything in your system, and because you can aspiration pneumonia is the main reason. So if you're having surgery, you need to be off of it. I was breaking out terribly on it, semaglutide. You know what? That is the third person to tell me that. And I actually need to do a video on that one. And then another person asked me about horrible, they're in menopause and they're having horrible cramps on menopause or with taking this, and they went off and that went away, and then they went back on and they started having horrible cramps again. So I got to do a video on that as well. That was a different one for me. I haven't heard that one before. Nausea. You need to get Zofran, and if you're having vomiting, you need to check your dose and make sure that you didn't give too much, because vomiting is not normal. Okay? Let me say that again. Vomiting is not normal. If you're vomiting, then something is not right. So nausea can be kind of normal, but vomiting is not normal. So if you are vomiting, then you need to get that taken care of. Your dose is too high, or you're eating something you shouldn't, or you ate to full and you shouldn't. So vomiting is not normal. So talk to your provider. Cut back your dose, get Zofran. You need to figure out what's going on. And if you're vomiting a lot, you need to go get IV fluids, go to urgent care. So broken promise, you need to go get checked because vomiting is not normal, okay? Anxiety. If you're already have an underlying anxiety, MJ, I have found, is causing a lot more anxiety. And that was from a post that I did on Recrea Health. We found out that just from a lot of people posting on it, it seems like MJ, name brand MJ, not generic or not Zepbound, but name brand MJ tends to cause more anxiety, especially if you have underlying anxiety. So talk to your provider and see if there's something else that you can do. And Kara, you didn't, well, you said you got pain in your side, nausea, and leg cramps. So I would definitely, Kara, talk to your provider because you've got a lot going on there and that's not normal. And I would definitely talk to them. I told you what T and S are. Difference between an NP and a doctor. Well, an NP is a nurse first and then goes on for additional training. So I have 9 years of education. I can prescribe, I can have my own clinic, but a doctor is a higher education and they can also prescribe. And so we're similar, but we're not. They have like their own license as well, but I was a nurse first and they have like an MD can do surgery, a DO can not do surgery. So they have more experience or higher license than I do. I hope I explained that properly. I was a nurse first. Could it help me quit smoking? Yes, actually it can. They have proven it can help stop smoking, drinking alcohol. They've actually shown it to help with some drug abuse. So they've actually shown some really cool things like that too. All right, so let's see. I was lost here for a minute, so I'm trying to go back up. Diarrhea on GLPs is typically caused by something you ate or simple carbs, or fried fatty foods, or something that you haven't ate for a really long time, which is fried fatty foods for me. Every once in a while, if I eat something that I shouldn't, I'll get diarrhea. But fiber, every single one of you should be on fiber, and every single one of you should be on a probiotic, which my new favorite is Leaf Air. Probably because it's gummies and it tastes good. And then also you should also do Leaf Air, and then you can do ZenWise as well. Both of those are really good for the ladies. The males, if you are interested, you can DM me. I have one for you as well. All right. I've been on Wegovy for 2 months, 1 week, and that's normal. If you need to count your calories, 13 to 1400 for women, 16 to 1800 for guys. Make sure you're getting your protein, which is 100 for women, 120 for guys. And then you need to make sure that you aren't under 1200 calories for women, or for everybody. Nobody should be under 1200. And if you at 2 months, you should have increased your dose by now. And your BMI, if it's in that 24.9 to 28 to 29, then it gets hard. And then you can reach out to us for the lipo burn, which has a fat burner in it, energy support, as well as immunity support. So that is something, especially getting into the winter and, all the flu stuff is going to start happening, the colds and all of that. The immunity support is amazing, and it can be something that we can help you with. That's exactly why I haven't tried a GLP, because I'm afraid of overdose. That is why it's important to have somebody like me in your back pocket, because myself and my team will help prevent that. We do pre-filled syringes. Our cost is $2.99 a month for S and then $4.50 a month for T. So please reach out to us and we can definitely help you. We would be more than happy to help you. Is there a symptom reduction benefit to splitting dose, half Monday, half Thursday? No. Not a symptom reduction. A lot of times why people will do that is to help control the hunger and craving, because some people will have increased hunger and craving at the end of the week. Sometimes it can help with the symptom reduction. So yeah, I have lost 80% of my hair. Holy moly, that's a lot of hair loss. So you need to make sure you're getting your protein, 100 grams a week for guy or women, 120 grams a day, not week, dear God, a week. Man, it would be so easy if that was true. Then you also want to make sure you're getting a collagen, which is this is a really good collagen, Nutrafol. And you could DM me for this. And then PU, you need to make sure you get on this. And I'm not kidding. This stuff is amazing. 95% efficacy of growing hair back. So this stuff is amazing. Who is eligible for GLP? Anybody with a BMI of greater than 22. And that is who is eligible. If my BMI is 22 and I'm struggling with fatigue so bad on S. So you need to make sure that you're getting enough calories, make sure you're getting enough protein, make sure that you are eating enough, and you may need to decrease your dose, because if your BMI is 22, you are on the minimum BMI that you need to go to. Your BMI is definitely on the low side and you do not want to go any lower. So you need to decrease that S, and you need to make sure that you're eating enough and you're getting enough protein and you are really you're healthy, because you are doing really, really well. So 5'3". Oh, I actually would have to punch that in. So actually, if you go to the CDC website and you punch in, you have to put in your age, your height, your W, that will give you where you need to be on your BMI, and that will help you. As a vegetarian, it gets difficult to get 100. Yes, it does. And I would recommend, I did a video that I asked what recommendations for protein for a vegetarian. So PU, go to the page that you're on, Recrea Health, and look up the video for protein recommendations for vegetarians, and that should help you. So definitely go look for that, and you should be able to find that. How long to be on each dose? Everybody is different. Everybody is different. I say don't increase your dose until you have increased hunger and cravings. That is when you increase your dose. All right, everybody, let's go back here. So some people may not L because they could be the BMI is too low. They are eating too much. They're not eating enough. They are resistant. They are, you need to go to a higher dose. There's a lot of reasons why somebody might not be L'ing. And, so we just have to help you figure out what's going on. That is where that free consultation comes in, because I have to talk to each individual person to figure out what's going on. So that's what we do, is we actually help you figure that out. So what's the difference between S and T? One molecule. And a whole bunch of money, to be honest. So that's definitely. So can you go back and forth from one dose to another? If it's a dose that's close to each other, yes, you can. You can absolutely go back and forth. 1 week to the other. I don't really know why you would, but yes, you can. You don't really need to. I would say stay on the lowest dose that you can, unless you have hunger and craving, but you don't really need to go back and forth that often, but yes, you can. All right. So if you have constant nausea and you're in the bathroom all the time, you need to decrease your dose. You need to get those things under control. If you're having constant side effects of any kind and decrease your dose, you can go off of them, get these things under control, then go back on the lowest dose. You don't have to stay on these, everybody. You need to get your symptoms under control, then go back on. Why? I don't understand why being sick is a good thing. We don't want you to be sick. We want you to feel good. We want you to get these things under control, then go back on, or decrease your dose, back down a couple doses, get your body under control, get the symptoms under control, and then go back on them, or, then slowly increase back up. But make sure that, because if you're in the bathroom all the time and you're feeling miserable, that's not fun. You're supposed to feel good. You're supposed to have energy. You're supposed to, want to eat. You're supposed to be eating healthy. So don't make yourself miserable. And, so decrease your dose back down to half a dose. Definitely that's a good idea. We have a visitor.
Yeah.
That's my husband, everyone. All right. So why is it harder to lose if you are in the BMI of 25? Because you're getting in that healthy zone. And when you get into the healthy zone, you have to start doing the things that are required for you to learn to be in the healthy zone. So for instance, you need to get the calories down. You need to exercise. You need to, get that protein, because you don't have as much to L. That's why it gets harder. What's the best way to break the stall? The best way to break the stall is really start counting the calories, which we all hate. It really sucks. But counting the calories, we have to count the protein. Sometimes we have to throw in something like the LipoBurn, which has the fat burner in it. It has energy support, and it has a immunity support in it as well. But you have to count the calories. I know it stinks, but you have to count the calories, you have to count the protein, and you have to hit those numbers. You really, really do. All right. What can I take to make me have a bowel movement regular? Miralax is not working. Fiber, probiotic, magnesium. There's a 14-in-1 with on my Recrea Health page. I really like the 14-in-1. It really does work. Then do your Miralax every day. If you're still not having a bowel movement every 2 to 3 days, then I would add in Senna Plus, which I call the Big Daddy on one of my videos, actually 2 of my videos. And I did post almost all of these things yesterday, so the videos are on there. So if you need to go on there, the videos are all on the fresh on there, so you can go on there and see those. So that's really important. Can it help reverse diabetes? No. Diabetes is not reversible. Once you have diabetes, it is always there, okay? But it can help you better manage the diabetes. And if you're constantly monitoring diabetes, you can manage it. Now, it's never going to go away, but you can always keep control of it, which is a good thing. Getting up and moving helps with fatigue. Absolutely 100%. Did you guys know 2 weeks of doing something can break a habit? 2 weeks of doing it is going to become routine, and then you will not have it be a bad habit anymore. So if you start doing something, so like moving, going to the gym, or just start an activity of any kind, even if it's just marching in your chair, is going to become habit, and it's going to become a routine, which is a good thing. Hair loss. Make sure you're getting your protein. 100 a day for women, 120 grams a day for guys. Make sure you're getting collagen. All right, this is my collagen that I like. I take every single day. Now, before anybody says anything, my hair has been thin since I was 17. Okay, so don't be dogging on me. I actually did not lose and have not lost any more hair because I get my protein, I take my collagen. And then hair vitamin. I've taken this on and off throughout the years, but I really do like my hair vitamin. This is Nutrafol. If you're interested in the collagen or the Nutrafol hair vitamins, let me know, DM me, and I can help you. Can you do this if you had thyroid removed? Yes, you can. Okay, so Mira fiber gummies, I have heard are really good. So yes, those are out there. You can't take those. Hair loss is real. So, but you know what? Hair loss is not just a thing with GLPs. Hair loss is across the board with any kind of program that you do that requires you to go into a deficit if you don't get protein. You have to eat the protein. You have to. You have to have your protein. And that is 100% requirement for everything. So when's the best time to do your shot? In the morning or the afternoon? It's up to you. I tend to do it in the morning because mine has B6 in it. Or if you have B12 in it, you want to do that in the morning, because if you don't, you're going to have energy throughout the day and then you won't sleep at night. So that's really important. Supplements. I highly recommend a multivitamin 50 and over. I really, really like it. We have the LipoBurn available. So if you DM us or message us, I can help you get that. So definitely reach out to us and we can help you with the LipoBurn. I can't give you information on here how or where to get it. So just reach out to us and I can help you with that. So T with B12 or S with B12 or a B6 or those both are really good. That's what we use in my practice. I've only worked with compounded for the past 4 years. I personally have only taken or used that personally and prescribed it. And that's all I've ever used. And I think they're both fantastic. All right. Let me see here. All right, so again, hair loss, you gotta do protein, collagen, hair vitamin. And if you're interested, Nutrafol are my favorites on those, and I could definitely help you with that. If you're experiencing dizziness or vertigo, that is typically from heart rate, blood sugar, blood pressure, and it could be electrolyte imbalance. So you need to make sure you're hydrated, make sure you're getting your electrolytes. I personally like the Propel packets. I drink 2 of those a day, usually with my water. Make sure you're getting 64 to 80 ounces. If you're having any of those, get your blood pressure or get your labs checked. Talk to your provider, make sure they know what's going on and that they can help you with that. Zepbound for 3 weeks, no side effects. That's fantastic. You're lucky. Definitely lucky. So, all right. What shakes do I drink? I drink Herbalife. Those are my shakes that I drink. I actually, in the morning, I have Tezo chai skinny lattes that I drink. I get the carton of it. And then what I do is I mix that with 2% milk. And then I do a vanilla Herbalife powder that I put in that with my collagen. That's my first shake in the morning. And then in the afternoon, I will do my 2% milk again. And I will put, usually I like the orange. That's my favorite. And then I'll do 2 scoops of that and then 2 scoops of vanilla. And then that's my afternoon shake. So that's what I usually do. And then I usually eat dinner. I started GLP 2 months and have no L. So that is not normal. Usually, I mean, it can be normal. So 1 to 3 a week for women, 3 to 5 for guys. Depends again on your BMI. So what I suggest is reaching out for a free consultation. You can DM or message and we can help you with that. So what I would, you got to look at your calories, you got to look at your BMI, you've got to look at your protein, make sure you're getting all of those things, activity level. So there's a lot that has to go into that. But, that's a lot of what we do for education and teaching is to help figure out where you're at and what's going on. Protein powder makes my chest hurt. Now that's a new one. So my first question is it whey? Because it might be the whey that is actually bloating you that's making your chest hurt. I can't do whey at all. Whey, it hurts me so bad. So maybe try a non-whey. I've never heard of a whey. I do not like the patches at all. Patches I don't think they are effective. I don't think they work at all. All right, so let's go. As a vegetarian, it's hard to get it, get protein. So what I did post a video on my Recrea Health page, and they did do, it's all about vegetarian, and there's a lot of suggestions on there. So I would highly recommend going over there and looking at that. The hair question I've answered a bunch of times now. So protein is very important. You need to, women 100 grams a day, guys 120 a day. Make sure you're getting a collagen. My personal favorite is Nutrafol. And then make sure you're getting a hair vitamin. And my favorite hair vitamin is Nutrafol as well. And if you're interested in that, then please DM and I can help you. So thyroid cancer. It is thyroid medullary cancer, not papillary. So if you or anybody in your family have had thyroid medullary cancer, you cannot take this. The interesting thing is they've only had cases reported in rats, and it was overdosed rats. So there, as far as I know, there haven't been any cases reported in humans. And that is the only thyroid cancer that they have reported that you cannot take this with. So I'm about to start peptides. No, absolutely. Don't be afraid to start these. They're wonderful. Absolutely wonderful. So yes, I do see less insulin resistance on S and T. There's no different. They're both for it. Absolutely. So absolutely, you're fine. Can I use GLP with chronic gastritis? You have to be very, very closely monitored, and it depends on how bad your gastritis is. And you need to talk to your GI to make sure that you're okay, because it depends on, is it currently inflamed? Where are you at in your treatments and what's going on with it? Some people are fine. It actually helps them because it can help the inflammation, but you need to talk to them. Set up a consultation 9:30 a.m., but it's, Utah time. UTC. What does that mean? We're Eastern time zone. So, Carrie, call our number and we can help you with that. Veronica, Carrie, on the schedule. KERRI.
KERRI. I don't have people by their name or. It's by phone number or email.
Carrie, we don't have your name down. It's phone number or email. So if you can just give us a call, because I think you have our phone number. She's on the Recrea Health side. So if you could put our phone number in there, maybe that will help her. Or she said, okay, thank you. Okay, so Retta. So Retta is not FDA approved. It's not released by Lilly. And it is in the state of Ohio. I was told that I'm not allowed to prescribe it. So with that being said, I am not allowed to prescribe it. It is not supposed to be, it's not available. So it is in the gray market only, and I can't use it. So I will not use it, and I will not prescribe it. And it is only in the United States via other countries. So that is my opinion on R. I have S ready to inject, and just cannot bring myself to do it. Oh, Brittany, it's wonderful. Don't be afraid. Watch my middle pin videos and you'll be fine. And watch all my pin videos. Yes, thank you guys for clarifying my S and T things. So yes, JB, you are eligible. So reach out and we can definitely help you. My doctor won't up me. Oh, well, hey, if your doctor's not working with you, give us a call. What's better, the patches or shots? Shots. Acid reflux, you can do Tums, you can do omeprazole, you can do Nexium, you can do a prescription, which is Protonix, any of those. Don't eat simple carbs. Simple carbs are your number one culprit for and digestion and GERD. Do you recommend any compounded tirzepatide? Call us. Reach out to us. I can definitely help you. I take care of the prescription. I take care of all the side effects, the symptoms, helping you prevent that. I definitely can help you with that. Yes, you can be on these if you've had your thyroid removed. Absolutely 100%. Good morning. When do I know I'm ready to go up? When you have food noise and cravings, you can definitely go up. All right. People are putting in their protein. Fantastic. That's awesome. Getting ready to go on Ozempic today. Don't know the side effects. Nausea, constipation are your two biggest. So go to my Recrea Health page and watch those videos because they will tell you how to avoid those. Make sure you're on fiber. Make sure you're taking a probiotic. Make sure you have magnesium. 14-in-1 is a really good one that's on my Recrea Health page. Make sure you have Miralax in your medicine cabinet just in case you need to move your bowels every single day. And then if you are somebody that gets nauseous, make sure you talk to your provider so that you have Zofran available. All right. Thank you, everybody, for putting your protein in here. How can we get GLP Med without paying a membership fee? We do not have a membership fee or contract fees. It is a flat $299 for S and a $450 for T. So if you need anything, please let us know, and we can definitely help you. We cover 47 states. I'm starting today. Thank you for the information. You are welcome. Why do I always get sick and have to stop? You might be increasing your dose too fast. You may not be eating the right foods. You may not be eating too much. There's you might not be eating enough calories or too many calories or too many simple carbs. You might be, there's so many reasons, Miranda. So I would say reach out and we can definitely help you. So the hair loss, you have to get your protein, 100 for women, 120 for guys. You have to make sure you're on a collagen. That's very important. If you are losing a lot of hair, then I would highly recommend that you're doing like the Nutrafol hair vitamin. Absolutely recommended. I do not like keto diet. I do not recommend it. I don't like fasting. I don't think there's enough time during your fasting time to get the protein that you need. So I do not like keto because it's not natural. It's hard to maintain and you can't continue it forever. You have to get your vegetables. You have to get those vegetables. So I highly recommend that you are in 75% protein, 25% complex carbs, because you have to get those vegetables and protein in order to maintain. So I do not like ketogenic diets. I do not like ketosis. I don't think it's natural. And I just don't recommend that you do the keto or fasting, intermittent fasting. I am located in Medina, Ohio. My name is Angela. I am a nurse practitioner. I guess we've been on for more than an hour. I should have told you that a long time ago, but I just saw somebody ask where I'm at in Ohio. Yes, you can. If you have Hashimoto's, it actually works really, really well with Hashimoto's, and it is it was wonderful for any thyroid disease, actually. So if you are resistant and you are not Elling, I highly recommend that you give us a call. It is hard to tell each on here in a broad talking to everybody because we currently are talking to over 200 people, but calories 13 to 1400 for women, guys 16 to 1800, never less than 1200 for anybody. Protein 100 grams a day for women, guys 120 a day. Then your BMI, if you're in that 24 to 28, 29, then you need to make sure that you are getting active and you're following those other three things. Count your calories. It sucks, but you have to. And then if you are doing all of those things and you still aren't doing it, I advise you to take LipoBurn. We are talking about GLPs. And also, if you're in that over 40, 45 group for women and men, we may need to talk about hormones. So there are all those things that you need to talk about, and we're here for that. So I love GLPs. I think GLPs are life-changing. So definitely reach out. I struggle to tolerate even the starting dose. Any tips? Yes, we have actually been able to take people even to the half a dose of the starting dose, and they do fantastic. And we do Zofran the night before, the morning of, and then after injection, and they tend to do great. So we can definitely help you with that. Since it's my first month's lowest dose, I want to go up 5th week, so I can, absolutely, you can do that. I'm on my 2nd month of semi-compound. I'm not noticing difference. Okay, this is a common theme today. In my practice, typically the 1st and 2nd week, everybody yells. I don't know where you guys are getting your product from. Okay, can everybody hit your hearts for a minute? I'm gonna go on a soapbox. Okay, everybody hit your hearts. All right, I'm gonna wait for you guys to hit your hearts, because when you hit your hearts, what happens is this triggers a video, and I'm gonna go on a soapbox for a second, because you guys have been making this comment a lot today, and I really want to hit a point here. Okay, so typically in my clinic, 1st and 2nd week, we have a significant L, a loss. And you guys are putting in these comments that you're not having a significant L in the 1st month. I don't know where you're getting your product from, but this is it's a lot of it concerning to me, because what's happening is I'm concerned on the concentration, and I'm concerned on what you're getting. Because, for instance, I had a gentleman start last week. Now, he had a higher BMI. I want to say his BMI was 38. And he lost 11 pounds in his 1st week. I hope I don't get in trouble for this. But he had a significant L. Now, his BMI was higher, but he had a good L. Now, I'm not sure. Everybody needs to look at their concentration, because our concentration of S is 5 milligrams per 1 ml. And I know a lot of you, your concentration is 2.5 of 1 ml of your S. And then your T is 10 milligram of 1 ml, where ours is 20 milligram of 1 ml. So the concentration is definitely different. But I don't understand why you're going 1 month or even 2 months and not having any L. So that, and then I am hearing that there's concern of my pricing, because my pricing is $299 for 1 month for S, and then $450 for a month for T. And then, so I'm concerned of where your products are coming from. So, and now I'm off my soapbox. So I know you need to watch the and I teach this with everybody that starts with our services. You need to watch the calories, and that's 1,300 to 1,400 for women. And then you need to watch for guys at 1,600 to 1,800. You have to get your protein, 100 for women, 120 for guys. The BMI is a big thing. The higher the BMI, the easier it is. Women are 1 to 3 a week. Guys are 3 to 5 a week. And it's cardio protective. So a lot of times you're going to have a lot of water loss that first month even, so it's, so there's a little bit of concern there. So I just want to throw that out there for you guys, because I'm really just because I keep seeing this comment over and over today, and I don't know why. Yeah. And here's another one. So it's, it's really, I don't know what's going on today, because it's actually more today than normal. So I'm not sure what is going on here. So dehydration, elevated heart rate. Elevated heart rate and dehydration go together. So if you're dehydrated, you need to bump the water up 64 to 80 ounces and throw in electrolytes, because the electrolytes are going to help with the dehydration, and they're going to help decrease the heart rate, because it has a lot of really good stuff in it. So you need to definitely make sure that you are getting hydrated. Hibernation food. You know what? I'm freezing to death, and I'm in Ohio, and it's stinking cold, and it's only been 50 degrees. I was joking around the other day and said, oh my goodness, I'm going to freeze to death. Grunes, I've heard, is fantastic. I personally have not tried it, but I've heard it's really, really good. So if you want to do Grunes, then you can try that for sure. Somebody would these shots affect someone with 1 kidney. My mom needs them. She has a doctor's appointment to discuss. You have to definitely talk to find out, because it depends on the function of that 1 kidney and seeing what the kidney doctor says. First day yesterday, 50 in the morning. Today I woke up 6:30, slept So you had a lot of indigestion. You need to make sure you don't eat simple carbs. And you had gastric sleeve. You have to know simple carbs. Stay away from carbonation if you had that gastric sleeve, but make sure you're very, very, very careful on what you eat and how much you eat day 1 through 3. Because if you eat too much, or if you eat the wrong things, you will be very uncomfortable. If you have no appetite whatsoever, you need to decrease your dose. And because you have to get that protein in. And if you can't get your protein in, you need to decrease your dose. If you have gallstones already, is it safe to be on these? Yes, it is. But I did a deep dive because a nurse, I guess, went wild on TikTok and was posting that it is not safe and GLPs will cause gallstones. So I went on this deep dive research. It is not necessarily the GLPs that cause the gallbladder attacks and the gallbladder gallstones. What it is the change in your diet, hydration, and obesity causes the gallstones. So it's the change in your diet that can actually cause the gallbladder attack. So what you want to do is be careful, stay very well hydrated, and make sure that you're eating very healthy because that actually can cause the problem. So long-term use and negative health impact. First, they have been finding a lot of research stating that it is actually better in the long term for your liver, your kidneys, your heart, and your nervous system than the other negative. There's not very much negative. If you manage your bowels well, if you are managing your, you're not going up too high your dose and causing gastric problems. And then the thyroid, vision, and pancreatitis, all of that is very rare as long as you're managing everything. And if you develop any of those symptoms, then you're immediately going and getting checked. If you're doing that, then you don't have any long-term negative effects at all. So that's what they're saying. If I haven't answered your question, then I suggest please DM me. I have just a few more minutes that I'm going to be on live, and then I'm going to go ahead and get off of here. So I just wanted to let you know if I have not answered your question. Intermittent fasting, keto, I do not approve. I do not like. I don't think they're good. Keto, we can't sustain for a long period of time. It's not what our bodies are naturally made to do. You need to get your vegetables, and you need to get your complex carbs. Intermittent fasting is not enough time to get all the protein in that you're supposed to have. You're not supposed to have more than 40 grams of protein in a 2-hour period. Your body won't actually absorb it. So it's hard to get into that fasting time. Please follow both of my pages, Recrea Health and Recrea Wellness, as well as sharing my live. I really do appreciate it. I'm usually on live Monday, Tuesday, Thursday. There is a football game that my husband will be at on Sunday, so I might go live on Sunday, just to let you know. So you keep your sugar up by consistently eating throughout the day. So what I do is I do that with my protein shakes and my dinner, my meal. So if you consistently are eating throughout the day or drinking your shakes throughout the day, then you should be fine. So actually Hashimoto sometimes will be either or, gain or loss. It depends on the person and what's going on with them. Okay, yeah, so it depends on the concentration. So this person switched from S to T and was told to not go over 95 units. It depends on the concentration. Ours is 100 units, so it just depends on the concentration, and each provider is different. I'm so close to my goal. T doesn't work anymore. It is still working. It will still do its job. You might have to add in the lipoburn, which is a common. I was in a stall for 1.5 years. Okay. So it is, you have to do more sometimes. Count your calories, count your protein, get active, add in the lipoburn. There are just some things that you might have to actually do to help your body, because when you're close, it is hard. It is hard. You have to do some extra things, and you can do it. You can do it. I'm stalled for 4 months, thinking of stopping for 4 weeks and restarting. I've done that. You can do that too. And that's not a problem. I've done that, and it worked a little bit, but sometimes, like I just said, counting your calories, counting your protein, making sure that, you can try adding in the lipo burn. Sometimes it's not the med stopping working. We learn to work around the med and we start adding in little things. I figured out, I can't eat licorice, but I can eat Skittles, or I can have a small ice cream. So we learn to work around the med so that we're not getting sick. But then, that's not helping us in what we're supposed to be achieving. So, that's the difference. Aetna just approved. Oh, that's good. Good job. If you get blurry vision, it could be a medical reason, but you need to see your doctor, your provider, and make sure you get that checked. I was told I was in remission from diabetes. Okay. Last I heard, you can't go into remission. Well, remission means it's still there. It's just like you have, I don't know that I agree with that. I was never told that Skittles are poison. They are poison in more ways than one. But I was told diabetes can be managed but never goes away. So if you close your eyes and pretend like it's not there and you go back to your old ways, it will rear its head and come back with a vengeance. So don't ever close your eyes on it and don't pretend like it's not there, because what will happen is it will come back and it will bite you. So yes, fantastic. I am so proud of you getting your A1C down to 5. But do not close your eyes, because it's still there and it can come back and get you. So definitely don't close your eyes on it. I did great on 5. So if you don't have food noise and you don't have hunger, then don't go up. Save it. Okay. Just save it. So milliliters and units. Some syringes, actually all these syringes I have here are units. So this syringe, I don't know if you can see it, says units right here. Okay. So that's 100 units. But if I were to go get another syringe and it would say 1 ml and it's the exact same thing. But what it does is it breaks it down on this here a little bit smaller. But another one would be 1 ml. So they're basically the same thing. It's just broken down in different numbers. So it's 100 units is 1 ml. So it's basically the same thing. And actually, so you can go 50 units on a syringe and it just breaks it down a little bit smaller. And this is a 50 unit syringe. And I'm showing the wrong, not showing the other group. So this is a 50 unit, and actually the numbers are rubbed off because I've used it so much in teaching. So this is, I'm going to show the other side as well. This is a 50 unit. This is a 1 ml. Can't really see it. I'm sorry. So yeah, you can't see it on the Recreate Health. I'm sorry, guys. So that's the difference. Average weekly weight loss, 1 to 3 for women, 3 to 5 for guys. All right, I'm trying to get through these. I am way behind again, always. I'm sorry. So if you want some really good videos, go to my middle pinned video. Actually, go to my pinned videos. They're really good. They give you a lot of information. My friend suggested that I start loading protein and fiber today, so I won't get sick. Yes. You need to make sure that you are taking your fiber, your probiotics. You are taking your magnesium. If you already have constipation issues, make sure you have Mayorlax on hand. Richard, you are incorrect in what you're saying. Obesity is bad long-term. GLPs are actually good long-term. If you weigh obesity versus GLP long-term, obesity is way worse long-term than GLPs, way worse. Because if you look at what obesity does to a person long-term versus to what GLP does long-term, there is no comparison, sir. No comparison. Why are me and my wife getting super bad headaches on Retta? Again, Retta is not FDA approved. Retta is coming from out of the country. There is no regulation on it. You don't know what you're getting. So I am not allowed to prescribe it as a nurse practitioner that's licensed in the United States and licensed in the state of Ohio. So you don't know what you're getting. So I can't answer any questions on Rita. When looking for a provider, anything looking for to avoid, make sure that, well, first of all, you can use us. You can DM us for a free consultation. You can DM us to purchase our product. We are in 47 states, and our S is $299 in most states. Our T is $450. We cannot cover you in New York, Kansas, and Wisconsin, but we can cover you in every other state. And when you're looking for a provider, you want to make sure that they are using an FDA regulated pharmacy, which we are. And I'm very picky on my pharmacies, extremely picky on my pharmacies. One of my pharmacies I have been using for 4 years, and we are extremely cautious, and I follow all FDA and Ohio Board of Nursing laws and regulations. And you want to make sure that whatever pharmacy or clinic or whatever you're using is FDA regulated, because that is extremely important. There are so many companies out there. There are so many pharmacies out there. If you can't physically get a hold of a clinic, don't use them. I heard on the way in on the radio this morning, you don't have to physically talk to a person. You could fill out a form online and never speak to an individual. That scares the crap out of me. Why would you want to do that? Why would you never want to talk to a person? If you get sick, who are you going to talk to? It scares me. That scares me. You're never going to get the proper education or teaching that you need to be safe on these. So that's scary to me. Okay. GLP and type 1 diabetes. It's not approved. And so they say that you can't do it. I have had 2 people that have done it and they've had great results. But you have to be very carefully monitored to do that. Hitting a plateau, hitting a stall, no L. What you need to do, you have to count calories, you have to count the protein, you have to look at your BMI. So those are things that you need to DM me, and I can help you with that. My team and I can help you with that, but it's very important that you reach out to us directly, because I can't do that here with over 250 people because it's individual cases. So lipo burn comes in place with that as well. So definitely reach out to us. So, be careful with these online pharmacies, everybody. Yes, you can use these with gallstones. Gray market, not regulated. Not regulated. You don't know what you're getting. And it could be different from one day to the next day. And I've heard it. I've seen it. It's coming from anywhere and everywhere, and it's not regulated at all. So, and don't worry, you're not being rude. Very rarely are people, I don't care if you're being rude or not, actually. I've been doing this a while. So I am regulated by the Board of Pharmacy in Ohio. I am an actual nurse practitioner. I have my license. I am a legit provider. I have a clinic in Medina, Ohio. So I am a licensed medical provider, and the gray market, you don't know who they are or what they're doing. They could be up in Canada. They could be down in Mexico. You honestly don't know where they're at. And you may call them today. They may take your money, and then you never get a hold of them again. So you need to be very, very careful with the gray market. And they like to steal my stuff and make you think that I'm affiliated with them. And I've already had that happen. They've been taking people's money, and then people call my clinic thinking that I'm a part of them, and I'm not. So if you ever see my stuff, then be careful with that. Oh, Brianna, you're in my backyard. Wonderful. Come see me. I've lost my W. Can I stop W? Or stop? Yes, you can wean off. If you ever want to get off of these, wean off. Don't cold turkey off, because the noise will come back like a vengeance. The hunger will come back like a vengeance. And it is really, really difficult. So definitely wean off, everybody. All right, I have 3 more minutes. If I did not get to your question, please, 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 please reach out to me. Our pricing is all the doses. There's no membership, no contract, no cancellation fees. Our pricing is one price regardless. So if you need anything, if you need prescriptions like Zofran or anything like that, our pricing is all the same price regardless of whatever you need. We're always here for you. You have a personal cell phone line to text us if you ever have questions or if you ever need anything. You are always able to get a hold of us. So that is just how we work. And I'm brutally honest. I'm always here for you. My team is great. They've been with me for a while. So you are always able to talk with us. Okay. I'm going to try and run through these questions here real quick. T is more than S because when anything has been out on the market longer, then it's usually less expensive. Or sorry, when anything is long, so S has been out on the market a lot longer than T. That's why it's a lot less expensive. Our S is $2.99 in most states. Our T is $4.50 in most states. So Hawaii is a little bit more expensive. Alaska, it depends, is a little bit more expensive, and California. And that's a little bit more expensive. So just so you know. And then we have no contracts, no memberships or anything like that. Please follow both of my pages. Recrea Health is my main page. There are products for sale on my page, and they are products that I typically are taking myself. If you are interested in the Nutrafol collagen or the Nutrafol, DM. If I didn't answer your question, DM or message us. We are more than happy to help you. Please follow both of my pages. And then I might be on Saturday during the Browns game. I don't like football. My husband loves it. He'll actually be at it. But I will probably be on live during that time. So if anybody is interested, you can watch me during then. And then if you have any questions, please definitely reach out. I do lots of videos. I do lots of education and teaching. If there's something in particular that you want me to talk on, or if you need me to research to get you some information, DM me and I definitely will do that. I'm always looking for new things to talk on. So I want to thank you. You guys are phenomenal. I know I missed a lot of questions. I apologize. Thank you so much for everything. Wegovy does not tend to cause anxiety, but I can't say that it doesn't. So, definitely, reach out to your provider if you have any of that. If you're having a weird symptom and you're just not sure, reach out to your provider. That's why I say it's important to have a provider that's there for you, a provider that's, going to answer your questions. That's why I'm so afraid of these online, and they pop up and they disappear, and they're scary. So I've been in business for 4 years as a clinic. I've been doing this for 4 years. I've actually been taking the medication for 4 years. So that's me in the background. This one right here, that girl right there, that's me. Okay. So, anything you guys need, I'm here. My team is here. We're more than happy to help you. So just reach out. All right, you guys.